Welcome everybody. It's a great honor for us to have you here, and it's an extremely exciting project, and we are proud to be here. So my name is Francesco Benedetti, and I'm a postdoctoral associate in chemical engineering at MIT. And within the Govt Safe Paths project, I lead the implementation team with Khalil and Sienna, that I believe are also in this presentation. And Kristen.
Yeah, my name is Kristen, and I am a current master's student in the System Design and Management program at MIT. For our team, I help lead the communications team, and also just very excited to have you here.
Thank you, Francesco. Thank you, Kristen. I'm Ramesh Raskar, Associate Professor at MIT Media Lab. And let's talk about Govt Safe Paths, a solution for contact tracing, for restarting the economy, and building resilient societies. Many of you remember these challenges of patients, such as in Korea, who end up coming in contact with thousands of individuals, and authorities have to backtrace these 1,000+ connections to avoid the spread in rest of the society. And if you try to use that with a digital method, the challenge is that this could lead to a surveillance state and a Big Brother solution. So how can we achieve that? We want to create a digital contact tracing solution where you can be notified if you have cross path with someone, and that would be with a tool called Safe Paths, I'll talk about, and also send an alert that provides some context and location where the contact may have occurred using technologies such as GPS and Bluetooth on smartphones in coordinations with tools like Safe Places that will be used by government health officials. Now we know this challenge. We willingly give away our location to Google Maps, so we have very little privacy. And Google, being a benevolent company, can take all that data and show us where the traffic is. We would like to have a similar solution for the epidemic as well. We want to show where the traffic is in terms of all the hotspots. But we're simply cannot do that because in an epidemic, the health data is very siloed, and we are not able to use that in the same way. So it seems like privacy and utility are in conflict, but the solutions like Govt Safe Paths will show us that we can actually achieve both utility and privacy at the same time. And by privacy, we don't simply mean your privacy kind of on a Facebook or a Twitter platform, but it's also about consent. It's about health regulations. Often it's trade secrets between health organizations and pharmacy players and insurance players. Sometimes it's national security because social graph of a country is very important to keep secret. And after all this, what's an incentive for a healthy person to participate in this system? So there are many challenges there. And even low stakes information such as GPS coordinates, even if they're anonymized and aggregated, sometimes are not private. Solutions like Strava heat map that show us the outdoor trails for activities can end up showing the bases, the US Army bases in Niger and in Syria. And what about Bluetooth? Despite what you have heard, actually Bluetooth is less secure than GPS because Bluetooth is actually emitting a signal from your phone as opposed to a GPS that's simply receiving and can be very silent. So the fact that your phone can be emitting a signal can be snooped by widespread third-party apps and create a really large surveillance network. So there are many issues we have to deal with here. So Govt Safe Paths app that you can download right now on iOS and Android in V1 is simply logs your personal location in a personal diary that stays on your phone and you never ever have to share with anybody else. And you can also download public domain data about counties or zip codes in your neighborhood of how the infectious cases are. This is something you can already use in our app. In V2, as a healthy person, again, you never share your location, but you can start downloading the traces of infected people that will be released by a public health department after verification. And this is something already you can use in existing apps as soon as redacted trails become available. And version 3, we want to reduce the burden on health officials by triggering new features such as self-reporting, authentication of tests, and using computational methods to make that process even more private and secure. So as I said, you can download this app, Safe Paths mobile app. It's under private kit right now. And very soon it will show you if there's a data match or not a data match based on publicly released data of infected individuals. We also have the world's largest GitHub community for COVID-19 solutions. So please go to our GitHub page under COVID Safe Paths. And so the Safe Paths is a solution for citizens. Safe Places is a web tool for health professionals. And we're really proud that our team is working in coordination with public health officials. And they can use redacted trails that removes any personally identifiable information of the infected individuals and then anonymize and aggregate them so that they can be released under the well-known health privacy rules. And we hope that this will become an extremely fast and accurate method to do patient interviews of infected individuals. In some cases, the interviews could reduce to something that takes 30 minutes today down to just a couple of minutes. So we're very happy to work with our partners and public health officials, and you'll be hearing from them in coming days of how they're using these tools. So if you're a public health official or a government professional and you would like to work with us, please send us a message so we can share with you our current software, our current plans, our open source tools, and how you can partner with existing health IT software. So you can think of the comprehensive toolkit I just described in 3 different buckets. In the middle, we have the technology APIs that now or in the future will support telecom data, GPS, Bluetooth, Wi-Fi, and others. These are co-location APIs. It includes Bluetooth APIs like the Apple and Google, or the PACT API from MIT, or the PEP-PT from Europe. On the left, you see SafePaths app. Right now, the goal is to provide exposure notification and access to resources. But going forward, you'll also get personalized guidance, symptom tracking, quarantine verification, immunity passports, and so on. And we're working with many partners. So if any of you in this umbrella organization of SafePaths wants to contribute to any of these modules, we'll be working with many partners. We don't want to build everything by ourselves. We'll be working with many nonprofit as well as for-profit partners to make these solutions available. And on the right, as I described, the health professionals are working with us in the Safe Places tool. In the beginning, it's about doing case history and case management, but we also have tools coming up for health professionals for aggregation, predicting hotspots, spread analysis, coordination of at-home population who may be quarantined or coming out of quarantine, and integrated dashboards that can also provide certification, whether it's testing or immunity passports. So an exciting group of organizations that are coming up that are providing a comprehensive toolkit. The most important point to remember here is that SafePaths can provide all these solutions while maintaining complete privacy. We may not even have to ask your phone number or a name or home address and still provide these solutions so that the privacy of the individual is respected. At the same time, the aggregated data does not reveal anything about an individual. We're also very proud of the COVID SafePaths Alliance that has many partners from MIT SafePaths. We have mentors and researchers, including our work that has been shaped by WHO and HHS and Mayo Clinic and some of the leaders in the field. And you'll very soon hear from our nonprofit partner, PathCheck, from Greg Nadu as well. And there are many organizations that have joined forces with us. We welcome them. And if you are a team that's working on COVID-related efforts, especially in the digital space, we would love you to join forces with us. And there are many ways to work with our team and also join our GitHub. So think of SafePaths as 3 big pillars. There's a technology pillar that provides the mobile app and the Safe Places web tool. We have open source code, we have APIs, we have algorithms, as well as interoperable backbone. So we can work with any app that's out there, not necessarily the SafePaths mobile app. And also a backbone that can be used by many public health entities, not just in a state or a country, but internationally. We also have a think tank. You'll see many papers on our website about interoperability, privacy, landscape, and publications. And of course, we have a massive rollout implementation team in partnership with Ernst & Young, EY, which is about public health engagements, training, monitoring, and very soon you'll hear about venture capitals and startups and corporate relations that are being built on top of the SafePaths platform. If you're a public health entity These are the factors you should consider as you're choosing your next software. It has to be privacy first, it should be open source, it should be interoperable, it should support multiple languages, it should also support non-smartphone users so that its equity and inclusivity is important. It should be built with an ecosystem of public health. It should provide dashboards for hotspots and spread, not just a citizen-centric solution. And for public health, it's very sure that you're not locked in with a particular vendor with a closed source solution. So for many years, you'll be locked in to work with the same vendor. But by creating these lightweight solutions that are public domain, open source, you can work with our existing health IT partners so that we can provide you modular and ease of use tools. So of course, SafePass checks on all of these key factors. But if you're using something else, we request you to consider all these factors. Finally, there are a lot of questions about how does it relate to the Google and Apple proximity APIs. Let me briefly describe how it works and also tell you why it's a great news for open source platforms like SafePass. So the proximity API works this way. If you have a healthy individual and an infected individual, their phones talk to each other, whisper over the Bluetooth locally. Then the infected person uploads all the keys, all the Bluetooth keys to the server, and the healthy person can download all those keys on their own phone and see any of the whispered Bluetooth keys match with the keys that this healthy person has downloaded from the Apple or Google server, which is the same method we use for GPS coordinates as well. The only problem is in Bluetooth, you have some challenges with privacy and security because your phone, even the healthy person's phone, is actually emitting something in public domain. So you have to be even more careful about providing that. The good news here is that Google and Apple has promised to provide their own servers for hosting it. So that's great. If they had not done that, actually the Bluetooth-based solution would be less secure than GPS. So of course, SafePaths will integrate all the solutions, these APIs and all the other APIs being released in different domains. But it's worth spending a few minutes thinking about the difference between GPS and Bluetooth. First, unlike GPS, Bluetooth requires massive adoption for it to be effective at all. In Singapore, for example, TraceTogether has an adoption of 12%, and the square of 12 is 1.44%. That means that only 1.44% of the encounters are being recorded by TraceTogether. GPS, on the other hand, scales linearly because if there's a 12% adoption, 12% of the hotspots are being discovered by public health officials. The second is that the false positives and false negatives for Bluetooth are a massive issue. So for example, if the infected person was at a wedding and they left their phone in their purse and mingled with other attendees at the wedding, the Bluetooth may not be able to whisper anything to the nearby phones at all, but the GPS coordinates will actually capture that the wedding was a hotspot and everybody at the wedding should be quarantined and sent for a 14-day isolation and monitor them. So the false negatives can create problems for Bluetooth. The next thing to remember is that technology itself, technology for proximity is not a tracing solution because the users need to know where it's happening and in what context it was happening. If they're in a coffee shop, maybe they're not wearing a mask and they need to know. And they might be in a grocery shop where they're wearing a mask and they're already being careful. So even if they can alert that you are close to an infected person in a grocery shop, that's a meaningless piece of information. And for public health, just the fact that an encounter happened between two people is not enough. They need to know where it happened. So location, location, location is the most important part of contact tracing. And only with location can you get heat maps and spread analysis. And as I said earlier, beyond tracing, the solution also requires quarantine and health verifications and immunity passports, and all these things also require other tools. So SafePass is very proud to use GPS and Bluetooth APIs, but it's not just about technology, it's about tracing, it's about public health, and it's about restarting the economy. And as we start reopening the economy, the guidance from US government is front and center talking about testing and contact tracing as the biggest piece of this puzzle. So to conclude, to overcome this epidemic, we need a choreography by the government, choreography between all the different entities, but that can lead to a surveillance state. What SafePaths can provide is privacy preserving tools, so there's a coordination between all these communities, and still we can solve this public health problem, restart the economy, and create in the future resilient societies. Thank you.
So Ramesh, I think Francesco and Kristen are going to start fielding some questions and want to direct people to the Q&A rather than the chat for those questions. But just as they're kind of queuing that up, do you want to just say a few more words, Ramesh, about kind of what comes after this? If we're successful, what kind of difference does privacy by design, collaborative open source, public goods, and societal resilience, what do you see as the positive that can come out of this?
Yeah, thank you, Greg. I think the key here is to remember that as we are in the middle of this crisis, it's very important to solve the public health challenge, but this ability to perform co-location queries between two individuals are going to play a very big role. As we restart the economy, as the factories start opening up, we have to support the essential workers who are already out there. About 18% of employees still have to go to work physically right now, health workers, groceries, medical shops, banks, they still have to go to work, and they need our support, creating an early warning system. And as time goes on, we have to also worry about the second wave and third wave of this epidemic. And those pockets of hotspots is what public health authorities really care about. So they may not be as widespread as we have now, but these pockets will emerge. And those pockets have to be quickly identified and suppressed through the methods we already have. And testing is not going to happen for 7 billion people in the world overnight. So we need a fever trace and isolate solution, which means that if you just have early symptoms, we can conservatively assume that they're because of COVID-19 and immediately isolate those people and let everybody else around them know that they should isolate themselves as well. And this is how we're going to tackle this problem over the next 5 years. So restarting the economy is very important, but building a resilient economy that does not pit a neighbor against a neighbor. Because if you start using solutions that are not well thought out, it can have many unintended consequences. If individuals start getting alerts purely based on Bluetooth that says, hey, you have been impacted, you might have come in contact with somebody who's exposed, that can create civil unrest because people immediately start blaming possibly groups that are often discriminated against, ethnic minorities and bullying. They'll automatically assume that being in contact with this population is what's causing an alert on your phone because they don't have the context, because they don't have the GPS coordinate. They don't realize that actually that contact happened in a Starbucks, not when you are in a train sitting to a person who might appear from a minority community. So I think we don't want to create that civic unrest. And if you want to build a resilient society, it's important to build solutions that are holistic. And that's what we should be doing with SafePaths.
So that's really the vision that inspired me 34 days ago to get involved with this. And so I connected with Ramesh on March 12th and was inspired by the vision that you just heard and have been spending 14 to 16 hours a day, 7 days a week ever since then, along with Francesco and Kristen and the incredible people and community that have formed around this initiative. This is a movement. It's a global movement. We want everyone's help. And please be patient with us. It's, as you can imagine, it's hard to simultaneously create an effective organization made up of volunteers and then manage the outpouring of offers to support that we get. There's been over 900 people who have filled out our volunteer registration form. We have a process of onboarding people and trying to connect them with team leads. But it also creates a lot of stress on team leads to be constantly onboarding new people. So we're trying to find the right balance of that. It's going to continue to expand over time. These Saturday webinars are one way for us to kind of stay, somewhat more, outwardly moving to the community. But we really want to find increasing ways for other people, for everyone to get involved. So Francesco and Kristen, do you guys want to start fielding some questions?
Ramesh, what percentage of the population do you think needs to use this solution in order for it to be effective? So you touched on Singapore, but what about this combined approach that we have?
Yeah, so it's very important to use a multimodal approach. As I said, GPS scales linearly. If 12% of the population is using a GPS-based solution, 12% of the hotspots can be identified And that information can be shared in 7 o'clock news or printed in the newspaper, so that very quickly people who are at that wedding or people who are at that Starbucks or that grocery store can check, hey, I was at the same grocery store at 2 p.m. If I have symptoms, I should be careful or call the authorities. As opposed to Bluetooth, where you require 50, 60% of the population start using it. And even at 60% penetration, only 36% encounters will be captured. So you definitely need to have a holistic solution. As far as GPS is concerned, even one person in a town who downloads it is beneficial to them right away. And so we think the virality in a good way of the solution is important, because when the news starts flashing at 7 p.m. saying, here's the map for today of where the infected people were in a privacy preserving manner, it immediately shares the information with everybody, even the people who don't have a smartphone, even the people who don't have a phone at all can still benefit if it's a GPS-based solution.
So I have a question from Jürgen, and he's asking, so is there a map showing basically public data that people can access, and how is it going to be interfaced with the public basically?
Yeah, so the good news is that many jurisdictions are releasing more and more precise data. And so in Asian countries, actually they release maybe too much about the infected individuals, but in many countries, the data is being released by the county or the zip code or the pin code, as some people call it, is being released. And we expect more data to be released at the block level or even at the business level. I think that will be very important. And as I said, we want to use a combination of GPS and Bluetooth. So clearly any encounters that happen even indoor settings where GPS may not be enough is perfectly fine. And we'll also have modules that support Wi-Fi hotspots, in this case, good hotspots of Wi-Fi. And they provide also, accuracy up to 1 meter of co-location.
Great. And then I have a question from Marcus. So this is with regards to self-reporting. His preferred solution would be that public authorized health professionals would supply a key that users need to enter to report their infection. That way we'd have a complete decentralized system, but with central verification. Is that the idea behind what we're trying to do with SafePaths?
Absolutely. So we absolutely work with health professionals in the loop, and they would provide authentication schemes through our app, so that only valid and authenticated information is shared with everyone. And it's up to the individual to share which part of the data should be released in the public domain in an anonymized and aggregated manner.
So a very, very simple question, but I think it's important. What about the usage of battery for the phone if we combine so many different approaches, and how are we going to manage it to be sustainable for basically any type of model?
That's a very valid question about battery use. And as Greg was saying, I think what's going to happen is this movement in SafePaths is not just about solving the technology problem, but an ecosystem problem. And so we are working with our partners who would provide some of these APIs in a more and more efficient manner. So the great news is that at least on Bluetooth, we have big companies supporting that API in an efficient way. And we think similar solutions will emerge for other sensing as well. GPS is not a problem at all. But if we get to Wi-Fi and telecom, we want to use it in an energy efficient manner.
Great, Ramesh. And then I have a question about our partnerships. So are we working with the CDC, and which states can you tell us that we're currently working with?
Yeah, so the good news is that nearly every large health organization is in touch with us, and our work is shaped by partners like WHO and CDC and HHS and many state officials who constantly guide us on what the features we should have, what should the trade-off between privacy and information for public health, and so on. So we're very proud that we are in touch with more than a dozen states in the U.S. And about 15 to 20 international, 15 to 20 countries who are working with us. And if you are a public health official, we would love for you to contact us, because you can take our GitHub code and in coordination with us or an organization in your own country, in your own jurisdiction, you can take our source code and deploy a SafePaths for your own country or your own state and we can help you all the way. We are very fortunate that we have fantastic partners from technology companies, from consulting companies who are working with us. So if you're listening to this, I encourage you to go to our GitHub and create your own version of SafePaths. We're going to create a flagship solution, of course, that most people can use, but we realize that health, especially public health, is a very local topic. Every state, every country needs its own messaging, its own values, its own ability to create content and so on. So it's perfectly fine for us if each country creates its own SafePaths version, whether it's labeled SafePaths or not, we are not so worried about it. But we also have a backbone that will connect all these apps, no matter how you're branding it. Greg?
No, I was just sorry for interrupting. Up to 22 international communities.
Thank you.
So Ramesh, you touched upon a very hot topic, which I think has been also asked from Charisse and Patrick in the conversation, which is the immunity passport. And I think that this is a very hot topic because as we know, as we read, immunity is very hard to be determined. There's it's very hard to measure and quantify antibodies. There's evidence that maybe some people have been infected again after being infected once, and it would take anyway a very long time to determine if there is an immunity, if any. So what is the approach of the group on this topic, and how the app can help figuring this out, how this team can help figuring this out, basically?
Yeah, there are multiple aspects to it. There's a software aspect to it, and there's a biological aspect to it. So let me just talk about the software aspect for it now. We have very early conversations with certain partners who will be interested in providing serological tests. Certain states in the US are already doing that. But on the software aspect of it, the verification of that using a public ledger is very critical. And so we already have many startup partners who will be working with us to integrate those software APIs as part of SafePath. So again, if you're a company, if you're a startup, if you already have solutions in this space, we can easily work with you, because depending on the region, depending on the protocols, different solutions will be available in different states and different countries. So on the software side of it.
Excuse me, did everybody just lose Ramesh for a moment while his audio went out?
No, I was hearing him clearly. I don't know if that's just me. To me, it was clear.
But Greg, go ahead on the health verification side.
Yeah, so I just wanted to add, and I put it in the chat, a YouTube channel from a group that we've just begun partnering with in South Africa. And I think it's an example of the type of ecosystem that we're looking to build. They made clear that many folks there lack smartphone mobile technology, right? And so they're putting in place an approach to immunity verification that has I forget what the term that they used, but it's basically you use the phones of the healthcare workers, and then they use a QR scan process with paper in order to establish the same verification. So we're very interested in working through them and with many of the folks in the African community to develop also lower tech solution that accomplishes the same principles. So I recommend that people check out that YouTube channel.
Yeah, and if you, on that note, if any one of you have companies that we should collaborate with, or you want to collaborate with, this is a very open platform. We are not trying to compete, but we are trying to collaborate and create an umbrella organization that can help everyone.
So I have a great question from Mike. How will the app determine what the current or local health authority is? So for example, let's say you're traveling, and whereas you're normally resided in Massachusetts, you're in California for 2 days. How does that work?
Yeah, so the beauty of the app is that it's privacy preserving in the sense that the GPS coordinates on a healthy person's phone stays local, but that's enough for the phone to decide should you download the data set from California or download the data sets from New York, or for that matter, you could be a Brazilian with a Portuguese SafePaths app. And if you travel to Mexico and US, it won't really matter, because the intelligence in the app will download the corresponding data sets. And that's what we mean by the backbone.
So one question that many people have is, how far did we go so far? So basically, with how many countries are we talking for implementation, and basically who's interested in adopting our platform for tracking and beyond.
Yeah, so that's wonderful. I think we have come a very, very long way just in less than a month. And we cannot reveal the exact names of which partners. They have to make their own announcements. But as Greg said, we have 22 active conversations in international locations. And then many of them are reaching out, and we can't even respond to them anymore because we want to create a self-serve solution for all these countries and all the states to go forward. But if there are certain cases where it makes even more sense, we'll be engaged. But we will have a self-serve solution for you. And I recently gave a talk through my colleagues at MIT about solutions for government and health officials. We'll link to that, and you're welcome to see that. We have another talk coming up on Wednesday at 10 a.m. Eastern, which is 4 p.m. European time on Wednesday. So you're welcome to listen to it. That also about how, if you're from government or health officials, how we can work together.
Ramesh, we don't want to leave the impression that that we're full up or anything, though, right? So we welcome all requests for help from any country around the world, and we have set up a triaging system where we're able to efficiently respond in a very timely fashion, and then begin the process of onboarding through waves. And as Ramesh said, the intent is for this to be as distributed and self-reliance as possible. But we are committed to responding timely to every request from any jurisdiction.
And I should also, on that note, I should also remind that we also getting a lot of messages from university or intellectual hubs that want to influence their own governments. And so we totally encourage you to use your own talent, go to our GitHub, download the source code, and create a version for your own community, and then pitch it to your health officials and government. Say, this is an open source privacy first solution that achieves all the goals that are on this slide, in a way that is privacy preserving. And that's not just for privacy, but it's also for adoption. Because when ethnic minorities or underserved population feel comfortable in using a solution, it will be helpful for everyone. Because you don't want to lose out on a fraction of population that doesn't feel comfortable giving their information to the government. And because of them, the spread continues. So you want a solution that allows everyone to participate. And that's what SafePass is all about.
Okay, Ramesh. So I have one about safe places. What are the expectations that the healthcare professional will know how to appropriately harness the available data via safe paths? Are there any quick onboarding tools for health professionals at this point?
That's a wonderful question. Greg, you want to take that?
Sorry, I was actually reading a question there. Do you mind reading?
I'll answer the first part and then you can go. So the question was, what tools do we have for health professionals? So first of all, Safe Places is a fantastic tool, and we can walk you through how it works. But there are, as you can see on the slide, it allows you to dramatically improve the way you're going to conduct an interview with an infected person or an exposed person, and provide tools for scrubbing it, for anonymizing it, for aggregating it, for publishing it, and so on. At the same time, very soon we'll also have tools that will allow you to create hotspots and spread prediction and so on. So that's my first part of the answer. But Greg, you can tell more about what tools we have to interact with health professionals.
So I just put in also in the chat to everyone another great partner that came to us today, Corona Test Centers. And this is the type of tool that we would like to expand across all countries. So this provides an easy way to locate drive-through testing centers in the United States. So it's our intent to integrate this type of a trusted data service into the ecosystem. So those types of tools. And again, this isn't about, as Ramesh keeps on stressing, this isn't about us doing it alone or us doing it by ourselves. This is about us really trying to get all of you to work with us in this movement and to create your own derivative technologies that work within the same privacy principles, that have the same data interoperability, and have the same commitment wherever we can to open source public good software that just keeps on spreading all across the world. So this, if there's other examples of things like that, then please connect with us, and we're happy to start working with you.
We touched on the fact that countries are adopting and seem preferred Bluetooth-based approach. And we discussed already why probably that is not enough to provide a comprehensive information and the meaningful information to all the users.
Yeah, I think it's a very important point because there's been a lot of confusion. So the good thing about Bluetooth is that it can detect two people much closer, within 6 feet to 10 feet, which is great. And GPS simply does not have that kind of accuracy, which is great. Another good thing about Bluetooth is that it provides some level of anonymity because exchanging Bluetooth doesn't reveal your location. So that's great. So those are two good things. And the third, of course, the best news is that Google and Apple are willing to provide the APIs. Nevertheless, it's only a small piece of the puzzle. As you know, for contact tracing and for spread prediction, it's all about location, location, location. And if you can provide a privacy-preserving solution that also allows you to work with location, then public health can actually solve the problem. So it'll be very risky in multiple ways if there's a solution that's based purely on Bluetooth. One, adoption needs to be very high. Even at 12%, only 1.4% of encounters will be recorded. Second is that there is no context, so the population will stop believing in the solutions because they'll get random alerts, like we get Amber alerts sometimes, that they won't know what the context is. If you go to a grocery store, of course, you'll interface with many infected people, and all you will know is that, hey, you cross path, but people start believing in those alerts. And number three is that lack of context can create civil unrest because people won't be able to figure out why they came into contact with somebody, and they'll start blaming people that they want to blame in any case, usually ethnic minorities and so on. So for many reasons, for countries, it'll be very, very risky venture to create a solution that's based purely on Bluetooth. The right solution would be a blend between multiple technologies.
So people have downloaded PrivateKit, but it sounds like there's a new app coming out. Can you touch on our future planning and our roadmap?
Definitely, that's a great question. Thank you for asking. So PrivateKit SafePaths is an MIT app. That's a research app that we want to be out there, and it's always going to push the envelope in terms of technology. COVID SafePaths, which is launched by PathCheck, is the real app that will work very closely with health professionals, and that should be available in the coming days for you. And the COVID SafePaths will have all the other features that we just discussed, such as self-reporting, symptoms, and so on, all these features that you will see. So we will transition over from PrivateKit SafePaths, which is an MIT app, to COVID SafePath. But in the beginning, they'll look the same, but very quickly you will see our interaction with public health officials will be mainly through the COVID SafePaths. If you're somebody who's curious and want to see how the research ideas are coming up, continue to download the PrivateKit SafePaths app. But if you want to use it for COVID purposes, then it's about the COVID SafePaths.
Yes, I think we really covered most of the questions. I don't know if we still have time. There's probably other topics.
I'll say something, and I want Greg to share the final thoughts. So first of all, we are so delighted that this movement that started with a few people sitting in an office at MIT has gone well beyond MIT now. We have nonprofits, we have very large tech companies providing all the software support and technology support. We have huge consulting and business organizations providing rollout support. We have intellectuals providing help on creating a think tank. It has really blossomed in an amazing way. So first of all, we want to thank everybody who has joined this movement. The next phase is to deliver on what we promised. And we are very focused on delivering those solutions. And you'll see some amazing announcements coming up in the next few days along those lines. Our partnerships, our software, our rollouts, our algorithms, and so on. And at this stage, we continue to say that our goal is to collaborate, not compete. So if you have ways to build health verification, if you want to build a public ledger technology, if you have different types of data sets that you want to build an API into our thing, if you have a new technology, maybe ultrasound-based proximity detection, you want to embed that into COVID SafePaths. If you have if you're already a health IT company who's already working in the particular state or country, and you want to embed SafePaths in your solution. If you're a company who wants to get their factory workers, back to the working conditions, and you want to use any particular part of this solution, we are here to collaborate. We're not here to compete. Greg?
So I just put one final link into the chat to everyone, which is from the COVID-19 Credentials Initiative, CCI. Someone also asked panelists about Evernym, a group that we're working with through CCI. This type of verifiable credential that is being applied initially in the UK to verify that, that doctors have their credentials and can immediately enter a new medical facility, hold up their phone, prove that they're actually a doctor, have it be 100% verifiable, use zero knowledge proof. That same type of technology we see being used with the South African group around verifiable test results. And from the prior work that I was working on in education, we see that same approach being taken to how verifiable achievement assertions can be stored in students' digital learning wallets. So this new architecture of the internet that we're moving towards, one that puts personal data control at the center of every transaction, is fundamental to both what we're doing with SafePaths and what we expect to be doing after this whole global pandemic hopefully passes us. So there's a lot of great partnerships that are being formed in this ecosystem. I put 3 in the chat there, but please contact us and we will get back to you to establish ways to work with you in the ecosystem.
Thank you for joining us today and hearing more about us. We're going to try and make these weekly, so be sure to tune in next week.
Thanks everyone. Okay.
Thank you for joining us.
Okay.
Bye-bye.
Bye.
Thank you.